Good afternoon, everyone. For those of you who don't know me, my name is Betty Jean, and I'm a registered nurse. And so I'm going to be talking today about, as you can see on the screen, standardized patient, which this isn't a typical standardized patient workshop for those of you who have been to one, because usually we have an actor patient, and today we don't. We're going to go through a few scenarios related to medication administration. I know that all of you will know about this from your nursing, but maybe there's a few differences in Manitoba and Canada from where you've practiced before. So we'll take a look at the scenarios. Before I talk about medication administration, I want to talk about the term OSCE and CCA. You may know what these mean. OSCE is something that is called an objective structured clinical examination. And it's done in professions such as nursing and medicine and physio because they want to see if a person is meeting the same clinical standards as the country requires. A CCA is the Manitoba nursing term for a clinical competency assessment. And it's similar to an OSCE, but not exactly, because it also has examinations, written exams, that you do over a period of time, as well as some role play OSCE type scenarios. So in Manitoba, it's called a CCA for nursing. You have probably seen that on the College of Registered Nurses website. Now, I know one of you is going to have an assessment done in Saskatchewan. In Regina, they call it a SEC. And it's the same thing, they just have a new term for it. So Alberta and Saskatchewan use SEC, which is substantially equivalent. I even have to look it up. It's substantially equivalent clinical assessment. So those are terms, if you weren't aware of them, you need to be, because they may affect you getting your license to practice here. So today we're going to go through some scenarios. One of the things about an OSCE, where you're in a specific clinical situation, is that they're timed. You don't have a long time to think about what you're going to do. So you have to sort of quickly get it done because a bell will ring and you'll have to move to the next scenario. So they're timed. So it's a good thing to practice. There are lots of examples, I think, on YouTube and things on the internet that you can use as well. So that's what an OSCE and a CCA are. And they do affect you because you may have to perform a role play type of scenario for assessment. Okay. First, so let's get into medication. Now here's where I want you to use your chat box, if you can. Just give me a number. I know you studied medication administration in school. Tell me how many rights, and I'm sure we've all heard that term, rights of medication administration were you taught? So just give me a number. See if a few people can give numbers. Okay, I've got, oh wow, I've got 7, 5, 8, 10, 10, 10, 9, 10. Okay, good. They rate, okay, I think there's everything. There's 5, 6, 7, 8, 9, and 10. Okay, who's right? Well, all of you are. I think initially there were 5, and I'll just review the 5 with you just because I'm sure you know them, but just the right client or patient, the right medication, the right route, the right time, and the right dosage. Those were the first 5. And then it seems like nursing likes to add a few things on. So we've got the right reason, and that makes good sense. Why are you even giving this medication? The right education. And that's interesting because it's really education for the patient or the nurse. We're going to talk a little bit about these in a bit. Right to refuse, the right documentation, and the right evaluation. So the people who had all of the numbers are correct. It depends where you've gone to school. It depends what book you studied. I have a number of textbooks at home and they have different amount of numbers. So I think the max I've ever seen, the maximum number is 10. So these are the 10 that I found. Does anyone have a different right that I is missing from this particular list, you could chat, if you think of one, or one that you were taught, you could put it in your chat box, and we can see if someone comes up with something else, or something different than what's here. Anyone yet? The numbers came really quickly. That was good. None, okay. No? Okay, so from what I'm seeing is that most of you have learned the very same things as that's being shown to you. Good. I think if you probably should, if you don't know 10, it might be good to know the 10. So that's my recommendation, that you look at the other ones that you aren't familiar with and become more familiar with them.
Can we ask them that question?
Sure. I'm waiting to see if you have any answers to the question about, is there any of these rights that you're unfamiliar with or don't quite understand what they mean? I have to look at the, okay, all right, well then I'm gonna continue on. We're gonna go into it, don't move it quite yet, to a scenario. And the scenario is going to be very brief, and I'll tell you, I'll go through the scenario, and maybe then I'll ask the question at the end. So the scenario, we can see the screen, or the slide, yeah. The scenario is, you have a patient, and your patient has fallen while cross-country skiing and has a fractured left humerus. She is to be discharged home with a sling on her arm and a prescription for analgesics. When you review the prescription with her, she says,
I will take the 6 pills when I get home.
you review the prescription, because it doesn't sound quite right, and it reads, Percocet, 6 tabs, PO, Q4H, PRN. That's the scenario. My question to you is, first of all, is there anything wrong with this scenario? And you can write the chat box. And then we have somebody who's agreed to, we'll speak in a few minutes, because let's see, first of all, what's wrong, if there is anything wrong with this situation that you note. Yeah, even if you, so instead of telling me just, yes, there's a problem, tell me what the problem is that you see. Okay. Let's see here. Okay. Okay, so I'll look at some of the responses here. Some of you have written quite brief responses. Someone has said the term Percocet is not layman's term. No, it isn't, because this is a medication. It's an actual name of a medication, and it's a prescription which the patient will be taking to the pharmacy. So it's not, it doesn't need to be layman's terms. It needs to be in medical terminology. So it's a prescription. The doctor's written it, given it to the patient, and you're just getting ready to send her home, and you review the prescription with her. And you see, after she tells you that she'll take 6 tabs or pills, you read it. So another response said, 6 tabs and only PRN. It does say, also says Q4H PRN. I would read that, if I was reading that you could take 6 tablets every 4 hours when necessary. That's what that prescription means. So someone said the prescription is incomplete. There is no dosage. There isn't a dosage, but sometimes some medications, that's actually a really good point. Some medications are combinations, like Tylenol number 3 is a combination of acetaminophen and codeine 30. So you never see it written, acetaminophen, 325 milligrams, and codeine 30. It's called Tylenol number 3. So there are drugs that don't seem to have a milligram dosage beside them because they'd have to have 2 or 3 because they're 2 or 3 drugs in combination. Another one is Septra, the medication Septra. It's a drug and another drug put together. So you will read the prescription, will read Septra, 1 tab. So that's a situation where the dosage, you have to know your medication. If you see something missing out of a dose like this one, you'd have to look in a medication manual and see if that made sense. And that brings me to medication manuals. Most of you probably have seen a drug manual. And if you're in an OSCE scenario and you have a drug presented to you and you don't know anything about it, you need to actually look up it in a drug manual. And we have a couple, do we have a different drug manual here in the classroom? There are drug manuals for nursing, and on each facility you work in, the medication area should have a drug manual. And the nursing ones are better than the ones that pharmacists use because these ones are the nursing ones are for nursing. And it tells you things to look for. So that was a good point. Okay, where else are we? I'm just gonna look at the other responses. Okay, this is exactly what I was thinking of. A drug manual.
I don't think they can see it.
This one's called Pearson's Nurses Drug Manual 216. Oh, it's even new. This is the kind of manual that you'll find on most facilities. And if you're in an OSCE situation and you don't know the manual, you're allowed to look it up because you can't memorize every drug in the universe. It's impossible. Okay, I'm going to take a look at the other chats that I've gotten in. No dosage, okay? Someone has said the nurse needs to give the patient a brief information about the medication. Yes, that's not the main problem here. So we'll keep on going. There is no explanation in education, was another one. That's true, but that's not the problem we're looking for. Only to be taken when necessary, but the patient said she takes 6 pills when she got home. That means she'll take it right away. Yes, that's true, but that's not the problem I'm looking for either. Okay, here's someone has said 1 or 2 tabs is the usual adult dose. And that's exactly what I was waiting for. The dosage is incorrect. And maybe that's what some of you meant before. There is no dosage. 6 pills are too many. So this is an error that the prescriber, and it could be a physician, a physician's assistant, a nurse practitioner, has written the prescription wrong. It's incorrect. You are the nurse who sees the incorrect prescription for the patient. Now this is one of the big questions I'm going to get from you. What are you going to do about it? So the prescription's wrong. You know that it's wrong. The patient will overdose with this prescription if they take 6 tablets. What is your responsibility now that you've found this error? So does anyone want to speak to this? Okay, yes, someone says get a hold of the person. This is the part we want to role play because this is not the easiest thing to do, but it needs to be done. So I want someone to, I'll be the prescriber. Maybe I'm a doctor, maybe I'm a nurse practitioner. I want you to come to me and using all the best communication techniques you know, say something to me so that I know there's been an error.
Okay, so I'm going to put Harinder on.
Okay.
So I need to close the screen share now.
Okay.
And I'm going to stop the share. And there we go. And unmute.
Okay.
So Harinder, this is your role play.
So Harinder, I want you to, I'm the person who wrote the prescription that's incorrect. I want you to talk to me or talk and think of what you would say to me to communicate that this is a problem and it needs to be.
Okay. Hi, Betty.
Hi.
Actually, I was giving discharge instructions to this patient, and I just noticed this prescription, and I was not pretty clear about this. I want to discuss it with you.
Okay. Have you got the prescription there?
Yeah.
Oh, okay. And is that, who's it for again? Like the girl with the broken arm?
Yeah, it was for the girl who broken her arm, and we are going to discharge her with the sling on her arm.
Okay, yes, I remember.
Yeah, and it's written as Paroset 6 tabs, PO, Q4 hourly, and PRN. I was not pretty sure, like if it's 6 tabs every time, or it should be written as a 1 tab every 6 hours, every 4 hours.
So you're saying that I wrote it wrong. 6 tabs. Do you think?
Yeah, what I'm seeing is that it's written as 6 tabs, PO, Q4 early, and the patient said like she will take 6 tabs with just once, and then I noticed this. I think it should be 1 tab Q4 early.
Okay, so
that patient will not misunderstand.
Okay. Okay, thank you. I will take a look at that. Thank you for that, Harwinder. I was wondering now, could I get another person? Let's just do let's do a few other. You did good job. I'm going to see if anyone else would approach it any differently.
Thank you.
Thank you. Princess, we'll have you unmute your mic now too.
Hello.
Hi.
Hi, Dr. Betty.
Hi.
I'm Princess, and I'm the nurse going to give a discharge instruction to one of our patients here. Well, I have some clarification regarding with the prescription that you gave to her.
Oh, I'm sure it's fine. I'm sure it's good.
Well, it's written here that the patient should take Paroset 6 tabs per RM every 4 hours as needed. I would just let's clarify if this is the correct dosage.
Well, do you think it's wrong?
Because I have read from our drug manual that the usual adult dose is 1 to 2 tablet per every 4 hours.
Oh, okay.
Can you check on it?
Okay. Do you have a manual? Do you have do you know what the CPS is, Princess? You heard?
Actually, I haven't heard about it.
Well, since I mentioned it, we'll show it to you.
Okay, thank you.
This is a book for all of you. It's really gigantic.
Okay.
It's called CPS, the CPS, and it's where most doctors and pharmacists look up their medications. I showed you a different book, nurses, but this book has all medications in it as well. So this is probably what the prescriber would look at, not the nursing one, but the CPS. Most units will have one in their unit to look drugs up, because doctors have to look up prescriptions and dosages, except just like we do, right? So this,
Okay.
never hear that, it's a new term for you, CPS. It's all
Yes.
blue, it's always this color, and it comes out every year. This one is 2007. So the information in here is probably correct, but they always keep adding more medications, right?
Okay.
That's just a little, an aside. So you get me the CPS and I flip through it.
We don't have that in my home country.
It's a very valuable book. And you'll hear that term very commonly, CPS. Just
Okay.
it's an acronym for big, long pharmaceuticals, long words that we don't need to know.
Okay, thank you.
I'll look it up. Okay. Oh, I see. I did write the wrong prescription. Okay, yeah, that's an overdose. I'm very sorry about that. Can you please hand me that prescription?
Okay, I'll give it back to you.
and I'm going to tear it up and I'm going to rewrite it.
Thank you.
Writing it now. My new prescription will be Percocet 1 to 2 tabs, PO, 4H, PRN.
Okay, I noted it down, doctor.
Okay, and I'm going to, so then explain to the patient about changing prescription for her.
Okay, I'll give the instructions now that you give me the correct dosage.
You understand what it says? What does that mean? Tab to the patient. Or can't hear me? Are you hearing me? Okay. Prince, hear me?
Coba. Chicken. Chicken. Special. Apa tinawag mo ng chicken wings ah?
All right.
Kuya, sorry.
Whether you've seen prescriptions written 1 to 2 tabs.
Nak ni Rory.
I beg your pardon?
The prescription does not read 1 tab. It reads 1 to 2 tabs. What does that mean for the patient? How many can they take at a time? Okay, I'll answer my own question. Sometimes, I don't know if this is your experience, but with analgesics, you may see it prescription written, take 1 to 2 tabs, Q4 to 6H, PRN. Means that the patient decides whether they want to take 1 tab or 2. And then as a nurse, you are going to administer 1 or 2 after you assess their pain scale. And they can have it in between 4 and 6 hours repeated. So it's a range, and it's giving the nurse or the patient the decision making about how much pain that they're in and how much painkiller to take. So that's a way you might see it written. And I don't know if it's written in every country that way, but it is here for a lot of analgesics. There'll be a bit of a range. Princess was correct in saying to me that the dosage was wrong. For most of you, I'm asking would you challenge a doctor's prescription in your country of origin? And you could just chat yes or no. Would you go up to a doctor and say, this is wrong, it needs to be changed? Okay, I see lots of yeses. Great, because that's the expectation here. Yes, okay, I'm reading yes. Most of you have yeses, and great, because that is the expectation. The nurse is responsible if you see an error to have it corrected. And so yes, we would have to challenge the prescriber. And it's, how do you do that? You do it politely, you do it with a respect, because we all make errors, but it has to be changed. And if they tell you, they brush you off, you still cannot give that prescription to a patient. Now, with a prescription going to a pharmacy, the pharmacist should catch it as well. And they would have to contact the doctor. But you can't rely on that if you know there's a problem. So it sounds like most of you would have come from the same sort of cultural, nursing culture, that we do challenge things that are wrong, and we have to. Because always remember, in this country, you most often are not hired by a physician. They do not hire you, they do not fire you. You just work alongside them. you are hired by an institution and they work within that same institution, but they're not your boss in that sense. We need to work together because they have their regulations for work and our regulations for work. They can do things, we do with them, in conjunction with them, but we don't boss each other around. So I hope that makes sense and that it is what you would have done. So challenging an incorrect order is absolutely what you must do. Nurses are responsible, and we can be held legally responsible if we don't do anything. So we don't want to be in a legal situation either. Good. Any questions about that? You'll have to type it in the chat box. If you have any questions about anything I'm saying, any new vocabulary that is new to you, just type it into the box and I can talk about it, into your chat box. Wow, no questions? Not yet? Oh, what if you cannot contact the person who prescribed it? You would have to get a hold of them because you can't send the patient home with that prescription. So it would be, in this day and age, I know that most doctors have a cell phone and you can usually find them somewhere, just like you. So their office, if they were gone, you could find them and you could have them paged. You could usually end up finding them. Here's a question. What will be the next move? Can they see all the questions? Mm-hmm. Okay. If the doctor will not respond to the situation. That's a good question, but I'm almost positive that won't happen. Doctors and nurses work pretty well together. And if you must approach the doctor respectfully and not like a boss. They usually will respond. And you cannot send the patient with the wrong prescription. Say, okay, I cannot send this with the patient. It's wrong. It's not correct. What if the doctor still insists to give the same dose? You show them in the book. You get the book and say, here's the adult dose. I don't understand why this dose is so high. You'd have to, those are great questions. Actually, we can't read the doctor's handwriting. We always verify it to him or her, someone said. Yes, sometimes the handwriting is very difficult. It's getting to be less of a problem because a lot of times prescriptions are written on an electronic record. So you get a printout, like a printed prescription from your doctor with the medications typed. That's becoming more and more common. So they're much more easy to read. Can you ask for a second opinion if you really can't contact the initial prescriber? Yes, you could. In most institutions, there are doctors that work within the hospital. You could contact one of them and say, this is what I have. I'm pretty sure it's wrong according to my drug information. What do you think? You could do that. I would contact the pharmacy. Yes, that's also a good decision because the pharmacy in a hospital is a great resource of information, and most pharmacies would catch this as well. But I'm just saying to say go home with this prescription and let the pharmacy catch it is not correct. And you would document the fact that you went to the doctor and they wouldn't do anything, because then now legally you've covered, I approached the doctor concerned about the prescription. It was too high of a dose for the situation for the patient. The doctor refused to change it. I had to go to a different physician to discuss it, or now you might even go to your nurse manager. You would write it in your chart on your documentation, and that would cover you that you've tried to do what you've done, like you've tried to do the best thing. So that's situations that, real things you would do. Any other things on it? That's all good. Contacting the pharmacy is great. Asking for a second opinion is great. Showing the physician a drug book is great. Maybe the handwriting was the problem, or maybe they just erred in writing the wrong number. It could be many, many reasons for it happening. So not to be judgmental, but you want to practice safely. So that was good. Okay, so we can move on to another scenario.
Okay, I'm just gonna share screen again.
Yeah. Okay, where are we here? Okay, yeah. Here's the second scenario. Your patient is in a hospital and care home, which is like a personal care home, or a nursing home, those are all the same terms, and has an order for Lasix, which is also the drug furosemide, 20 milligrams POBID in the morning at 8 and at 1400. When you are to administer the 1400-hour dose, you note that the dose you gave in the morning was 40 milligrams. You gave 40 milligrams at 8 a.m. So you're the nurse. The order is for 20 POBID. And when you go to give the second dose, you note that you gave the wrong dose at 8 o'clock. Now, my next question is, what would you do in this scenario? What are you going to do? You're working, you're on day shift, you're almost getting ready to be done, and you realize you made a drug error at 8 in the morning. What are you going to do? So you can type some answers in there, or whenever we have someone to speak. Do we have anyone else volunteer to speak?
So I'm gonna just take this off.
Oh, someone said to check. Oh, here. Okay. Just a minute.
Nicholas had a question.
Okay, we see Nicholas. Okay.
Are there any legal implications if the nurse misses the overdosage?
Yes, there could be, Nicholas, about the overdosage. Yes. Nurses are responsible to be knowledgeable about the medications that they're administering or helping the patient with. So yeah, there could be a legal implication if you, I think it would be caught, to be quite honest, in the system, but the nurse would look not very good letting that go if they noticed it. No, there could be. Canada isn't really a big sewer, bad word. Canadians don't sue medical people very often. It's more common in the United States. But yes, legally we are responsible for what we do, and we have to remember that. That's kind of the big safety issue, over safety for our patients, and then do things that are safe for ourselves. So we could have some legal problems if we just let things go, yes. Okay, so what are we going to do with this patient with the Lasix? Now, this is not the patient that did anything. The nurse did.
So
Okay.
is there anyone that wants to speak?
Yeah.
We can unmute your microphone. And do you want them to role play something, Eugene?
No, they can just talk about it. Yeah, because there's not really another person to role play with.
Okay.
I'm going to put some ideas in their brain. Okay, I'm reading some of the answers that, first of all, that I see. No one has volunteered to speak what they would do. Okay, let's review what some people have said. Someone said, check the blood pressure. Not a bad idea. Yeah, okay. I would say that's a good thing to do. Someone else has written, inform the doctor about the error right away. Okay, that's a good thing to do. Another one says, inform the doctor, but don't give the 1400 dose yet. Great idea, good thinking. Hold that for a minute. Someone else says, inform the physician about the med error you made. Okay. Assess patient for any side effects. Good. Contact the doctor and supervisor and fill out an occurrence report. Okay, that was excellent. Number, Margaret. Contact the doctor and supervisor, fill out an occurrence report. And I want to talk to that. That is excellent. An occurrence report is when an error is made. When you're writing the language test called CELBAN, they use the term occurrence report, and it really isn't an occurrence report. It's really charting a situation, like on a charting note. An occurrence report is really something that happens that's unusual, like a medication error, something has gone wrong, your patient falls, you have to fill out an occurrence report. When you get that report, you fill it out. Usually you take the vital signs of the patient, you write down any other information that might be that you've noted after you assess the patient. Vital signs for sure. It'll sort of go through a list of things. You must notify your supervisor. The physician needs to be notified and orders can be received. So an occurrence report is a specific form that you will find in an institution, and it's not part of your normal chart. When you're doing your CELBAN writing, it uses that term, but don't get confused. The term in CELBAN that they use occurrence, they mean basic nursing charting. They give you a scenario with little information that happened, and they want you to chart it in good English sentence. It's an English assessment. An occurrence report is more fill in the blanks, write a few things here and there, and it's a form that we fill out. Now that form gets sent to the administration of your hospital. Now, we'll talk about that in a second. I'm going to look at some of the other things. Fill in a medication error form, right, which is an occurrence report. Assess intake and output, excellent. Vital signs, great. And inquire of the doctor about the next dose. Yes, because you may have a change for that one day. Good answer. Assess the patient's condition, inform the doctor and nursing supervisor. Yes. Withhold the second dose, assess the patient and inform the doctor. Yes. You may be given instructions to give a dose at some point anyways, and that's fine, but you don't give that dose till you know. Hold the dose. Take vital signs, inform the doctor or nurse practitioner, supervisor, and fill out an occurrence report. Yes. Incident report. Incident report, occurrence report, same thing. Okay. I have read that Lasix is sometimes used only once. Do not take extra med to make up the Do not take extra med to make up the mixed dose. Okay. But we don't decide that because we're not the prescribers. So we do have to ask the physician. An occurrence report.
Oh, that's just me, sorry.
Oh, that's Briar's, okay.
Just repeating
Okay,
what
good. So an occurrence report and an incident report are the same thing. They're just two different words for the same thing. And it's a specific form that you won't see on your chart otherwise, unless something's happened. Good, most of you have the correct answers. What the doctor will tell you depends on the patient's blood pressure, like you said, how much output they've had, and whether you want to continue, the doctor wants to have another dose given. If the person has a lot of difficulty, they may just say, hold the dose for today and give another, start tomorrow with the new one, but you have to wait for an order. Now, my question to you is, you're a nurse, you're the only one who knows that the dose was wrong. So you think, or your friend says, don't tell anybody. No one will really know. What do you think about that? Don't say anything. That really happened to me one time. I gave a dose at the wrong time. My fellow nurse, this was many years ago, said to me, don't tell anyone. No one will ever know. What do you think about that? Better to be honest, okay. Okay, here's some answers. Better to be honest. It's true. Not acceptable. Okay. Your patient's safety is your priority. Yes. But I mean, in this situation, an extra 20 milligrams of Lasix, is it going to hurt the guy? Do you think? Honesty is the best policy. Why is it the best policy? It's a difficult situation. Why are nurses afraid to report errors? That's a good question. You need to be liable about your actions as a nurse. Correct. Ethically, we do. Afraid to get fired. Okay, good one. Legal responsibility. Okay, all good answers. I'll tell you that you're right. If you fill out an occurrence report or an incident report on the fact that you made a med error and you hand it into your administration and you call the doctor and you've informed everybody and you've assessed your patient, they're going to think actually more highly of you than if you didn't tell anybody. Because ethically, we're responsible to correct our own errors and errors of those we see beside us. So if I'm working with another nurse and I know they're doing it, I'm making an error, I need to tell them, I need to report it, things that go wrong. It's part of our responsibilities as a nurse. And if you want to read about different ethical situations, you can go to the CRNM website, and even under standards of nursing practice, there'll be situations that say you're responsible for what you do, and you're responsible for your coworkers if they're doing wrong things. So we have to make sure that we are following those standards. If you hand in an occurrence report to your employer and keep a copy for yourself, shows that you did it and you handed it in, the chances of you being fired, I would say, are almost next to nothing. I suppose as long as maybe the patient doesn't die, because you've admitted your error, and that's the whole point of this, is that correcting errors, and there's lots of errors in medical field. We need to keep them corrected. It's an ethical duty, I'm reading Ralph says, to report and let the responsible parties know, including the patient and family, and that's true. We do need to do that. So when you hand in an occurrence or an incident report, it's not getting you fired. That's actually protecting you and showing that you have honesty and are a responsible person. If someone didn't hand it in and someone later found out, you could be in more trouble that way. So just reporting. So using safety, patients are our prime responsibility, and we do want to cover ourselves legally, and by filling out the form is actually covering ourselves that we have done what we should do. Just going to keep reading a few more chats here. Every error should be put into writing. Yeah, the nurse supervisor manager should be informed. Correct. So good. You guys have all the right answers. I'm impressed. Trust issues, someone writes. Yes, trust issues. I know if I was a patient in the hospital, I'd certainly like to believe that my nurse was working in my best interest. And I'm sure you would too. Responsibility, accountability as nursing standards. Right, exactly. Great. I know a few years ago, there were a lot of nurses who said to me, IENs, that they would really be fearful of getting in trouble and therefore maybe losing their jobs. I think some of you have had know your rights as a nurse, and making an error isn't necessarily going to lose your job. You're going to own up to the problem, and you'll probably be thought of, like I said, more highly. Good. That was a good one. And I think maybe you already knew all this information. So, yeah. Yeah. Okay, we're going to go back to. Okay, so we can flip the action next. Yeah, an occurrence report, so you can see it needs to be filled out, and the doctor plus the manager needs to be informed, and a new orders may be received. Will the nurse be in danger of being dismissed from her job? Likely no, because she's being honest and forthright with the situation. So great, and most of you had that answer. Lovely. Next scenario. Okay. Okay, never mind. Your patient has an ordered medication, Lasix. Oh, we're heavily into Lasix today. Lasix per aura daily. But when you go to administer the med, he says, I don't want this because it makes me go to the bathroom all the time. Okay, so that's the patient's response to you. As a nurse, what are you going to do with this? So send us a little information in your chat box again. See what kind of answers that you can come up with for this scenario.
Do you want me to go back to the chat box?
Sure, back to chat box, and you can write in. Okay, I'm seeing some come in here. I'll wait for a few minutes just to let you type before I start reading. Okay, there's quite a few here. Now, I'm just gonna, no, there, I think the top, go to the top of the educate. I think this is the first one. Okay, the first one I've read is educate the patient about the importance of Lasix in his treatment regime, in the treatment regime. And yes, this might be one of those, the patient has the right to education. They may not know why they're getting this. So you could ask a question. Do you know why this medication is being given to you? And they might say no, or they might yes, indeed no. And if they aren't knowledgeable about why they're getting the medication, they need to be informed about that. So yes, education is important for the patient. Inform the patient is one of the effects of taking Lasix. Yeah, that's a good one too. This medication makes you go to the bathroom to get rid of excess fluid. That's why it shows it's working. Good one. Explain the benefits, which is explaining how it works and why they're getting it. Good. One of the side effects, it's not really actually a side effect, it is the effect of the medication. Explain to the patient how Lasix works, including why he's urinating a lot. Give the benefits of the medication. And someone says, as well as the corresponding side effects. Yes. I will inform the patient of the importance of the medication and its side effects. Good. Give the right education or reason for why this drug is being given. And if the patient still refuses, then it's his right to refuse. That's an excellent answer. You might give all the benefits and the education to the patient that you can, and the patient says, I'm still not taking it. Don't give it to me today, I don't want that. So, this nurse that's written, the patient still has the right to refuse, and that's correct. We cannot make people take medications if they don't want them. But they need to understand that if they don't, there are effects too. Effects for taking a medication, there's effects for not taking a medication. And they have to, if this happened over and over, the physician would have to be informed that the patient was refusing the medication, because eventually it might have pulmonary edema. Maybe that's why he's on it. He's in congestive heart failure. He needs to get rid of the excess fluid, and there may be a problem with that. So someone says, explain the pros of the medication and that it outweighs the side effects of urinating. Well, that might be what we believe. The patient who has to get up to the bathroom all the time may not believe that that's a benefit. Talk to the patient to hear more about his concerns. Yes, educate him. Yep, forward his concerns to the doctor. Correct. And you may have to withhold the med as well. Lasix removes excess water from your system. It may be uncomfortable, but is beneficial. True. These are all education concepts. Yes. Okay, here's a good one. Give the patient the explanation of the drug. If the patient doesn't want it, then do not give it. And inform the physician and document that it's withheld or refused. When you're documenting medications, there's a form that we use called the Medication Administration Record. Also mostly called MAR, which might be the very same that you've used in your past. MAR, the MAR, and we call it the MAR. The MAR is where you record that you administered the medication, but also if it's refused, you could write refused and your initials, and then you should have a note in your documentation to say that the patient refused the med. You tried to encourage him and educate him about the benefits, but still refused the medication. So there should be a documentation piece in your nursing notes, or your, they're not just nursing notes, in the notes, and it should be refused on the medication record, or the MAR. Does everyone know the term MAR? It's spoken like MAR. It's written MAR, and it stands for, like I said, medication. Yes.
Medication. What does it stand for?
Medication Administration Record. Yes, I do the MAR sheet. Yes. Yes. Oh, okay, that's what it means. So most of you are familiar with that term. And what you'll hear in a nursing realm will be the MAR. Did you write it on the MAR? We call it the MAR. Silly things that we say. Okay, great. So you're all familiar. I've heard of the drug monograph. Okay, a drug monograph is something that comes with the drug. When you open up a medication from the pharmacy and there's a piece of paper inside that describes the drug, that's called the drug monograph, as opposed to the administration record. The administration record just says that I gave Lasix 20 milligrams, 0800, 1400, whatever I administer, and our initials and our name on it. Drug literature. Drug literature is more like a drug monograph. It's about that specific drug, but it's not the record that you write in a chart. The administration record is just that you gave the med and the next shift and the next shift. It's usually good for about 7 days of different medications recorded. It's if we're recording them. All right. So the patient can refuse. So that's right to refuse. Drug literature, drug chart. Yeah, it's the medication administration record is part of the chart, and it's where medications are recorded. So that's if a patient needs a medication, you flip to the part of the chart and look, oh, they had it last, like a PRN med. You flip through, oh, they last had it 6 hours ago. Yes, they can have it again now. So it's part of the chart. Okay, so scenario number 3 is the patient's right to education and the right to refuse. Those are both in there. Plus the right of documentation would be in there as well. So those would cover 3 rights at least. And of course it would be the right patient, right time, right drug, right dose, etc. The very first one, we go backwards. I should have talked about this earlier.
Share screen again?
Sure. The very first one was basically the right dosage, and there was a wrong dosage on there. So this one is wrong dosage. So the patient was correct. The rest of the prescription was okay, except the dosage was wrong. So that made it wrong. The second scenario was a wrong dosage given. So the right was not done. It was incorrect. So it's what do you do when you make an error? And it's important to deal with the downside of things. We always talk about when we do things correctly, but sometimes we don't do things correctly, and what do we do about it? So that was, what do you do when one of the rights has been violated by you? So that was good. Okay, we can flip forward to, okay, now I want to ask those of you listening, if you've got any questions, did any vocabulary come up that I've either spoken or you've read that you are not quite familiar with, or you'd like to have a little bit more explanation of? You could write it in the chat box and I'll take a look. And just for the record, this is the first time I've done this kind of thing this way. So it's new for me, and it may be new for you as well. Oh, a double signature. We called it the medication administration sheet. It's exactly the same as a MAR. Yep. In my previous workplace. Good. Someone says, we need a double signature in the MAR. Okay, good question. Okay, there's different scenarios for double signatures. Some nursing students, if you're a student nurse, require a double signature for certain medications. And you're going to have to look at that from a facility point of view. But for sure, if you are discarding a narcotic or a control substance according to Canadian laws, so for example, morphine, you get a vial of morphine, you admit to draw it for an injection, and you have to discard a portion of it, you must have a witness and you must have a double signature on the discard. On all narcotics, you pour a Tylenol number 3, and the patient says, I really hate that drug, it makes me feel weird and I'm not taking it. You don't put it back, you discard it, but you need a witness and a double signature. Some institutions require a double signature for insulin injections. Some require for a certain heart medications, or especially in pediatrics. So you have to know those things by the facility that you're working in and what requires a double signature. And if you're not sure, you need to ask, what meds do I need to get a double signature? Not all meds need a double signature though. Okay, good question. Oh, sure. Where can we see a sample MAR? Okay, well, I do have one, but not with me today. If you actually probably Google medication administration record nursing, you might see some samples of it on the internet. Every facility has something a little different, so there's not one record for every place you go. They might customize them. There are a chart here. I'd have to get Manola to maybe leave, not every one of you come here, a sample chart. I'll work on that. Let me write that down.
We can scan it?
A sample, yeah. We could probably scan one in and have it available for you to look at. But it won't be, don't memorize it, because everywhere you go, it could be a little bit different, but a sample would be good. You agreed? Yeah, okay. Sample MAR, okay. Well, I'll write that down for something to do. Oh.
Sample of them. Let's see.
Oh, she did, okay. Let's see that one. Thanks, Princess, take a look. Pinterest has a sample of a MAR. That's interesting. Oh, wow. Okay, yeah, those are all samples. Never thought I'd see it on Pinterest. Of all places. Oh my goodness. Yeah, there's more to see, I'm sure there are. Okay, so there, yeah, you can see where you write the medication in the blank box at the side, and then it'll have time. I can't see it very well from where I'm sitting because it's quite small, but that's a sample. But we could scan the one that we have here, and you could look at it as well. Okay, yeah. And it's got the 3 shifts, assuming you're on a, I'm trying to read that one. It's hard for me to read it.
Yeah, we need to
get
in.
Yeah. So we'll have to get either a scanned one or look at home. But you could probably see it better on your screen than on mine here. So yeah, there's an example. Well, I'll try and get one to scan in. I've written a note about that. And some places have 2. They have one for routine medications, and they have a second one for PRN medications. So there's 2. And if it's PRN, you go to the PRN side, and if it's a regular scheduled drug, like daily, BID, TID, then it's there. Good question. Another question says, could you explain Q4H and Q6H? It should be Q, oh, it says Q4H and Q46, it should be H, in more detail. Those are terms you should look up if you don't know them. Q4H, Q6H, Q8H, or Q12H. That's about all of them. And it means every 4 hours, every 6 hours, every 8 hours, every 12 hours. You might not see them written like that very often, but that's somehow some medications are written as prescribed every 6 hours. So you give it at 6 in the morning and 12, 6 hours apart. If it's written Q4H PRN, the patient can then take it every 4 hours if necessary or as necessary. So that's what that means. We also use daily, BID, TID, and QID. And those mean daily is once a day, BID twice a day, TID 3 times a day, and you guessed it, QID 4 times a day. But those may not be spaced out exactly. You could do every 6 hours is also QID, but some medications, it's not as important to have them taken in this 6 and 8 hour increments. It's like 4 times a day. And often you don't want to wake a person up in the middle of the night just to give them their medication, unless it's really, really serious. So that's what those mean. And that's a very good question, because you might not have been exposed to the same terminology. So all of those you should know for medications. Okay, anything else? What about telephone orders? Aha, good one. Telephone orders are a little bit interesting because they happen. Verbal orders should not happen. If you're standing beside someone and they're just telling you to do something, unless it's an emergency situation, you shouldn't accept a verbal order. They should write it, okay? If you can talk to me about it, you can write it down on the chart. So a verbal order should not be required. And most physicians are well aware of that. They write their orders. A telephone order is a little different because often the physician's not there and you have to phone them. A telephone order can be taken by a registered nurse. I don't think a graduate nurse or a student nurse can take them. So if you happen to be somewhere and you're not registered, don't take a telephone order. The telephone order needs to be repeated back to the person who's given the order. So the date, the time, the order as it's given, repeat it back, and it should be signed telephone order, Dr. Joe Smith / your name and designation. So they can be taken. If I was new on a job, I would certainly see what the institution asked about or wanted me to know about telephone orders, because you want to make sure that you're following the rules. And as a brand new nurse, I wouldn't take the telephone order until I was aware, especially of the area you're working in, because oftentimes there's so many new things to learn that it'd be better off to have someone else take the telephone order if possible. But it can happen, and but you need to know where you fit into the telephone order scheme. Okay, I see another. Oh, good question. Coming from a different nursing practice environment, we are not familiar with most of the medications being used here in Canada. Okay, different names, same medications, different names. So as a new nurse, how can we be aware if the medication prescribed was correct or not? And that's, how did you ever learn when you were a student? Can I ask you that question? When you were a student and you didn't know any of the names of drugs, wherever you were, how did you learn them? Look it up, right? You looked up a lot of stuff, right? The CPS, yes. Refer to a drug handbook. Yeah, have your drug handbook with you. And you know, you can get those drug handbooks like as a book, but you can also get an app for your phone. Now, I think it costs money, but so does the book. And you can put them in your phone. So you've got this book on your phone. That's kind of handy. And always then get a Canadian version, because if you have an American version, some of the US drugs have different names. Same drug, different names as well. Drug handbook, refer to the CPS. We have our drug handbook with us all the time, yeah. Although it's hard to carry it every day when you go, but usually it's in a medication area. Good. So you do have to look up the drugs, and eventually you become familiar with the new names. And in here we use both trade names and generic names, sort of interchangeably. And how many hours should the telephone order be signed by the doctor after receiving it? Good question, and I don't know the answer because I don't work in a facility right now that has telephone orders. So I don't know that rule. That would be a policy of a facility. So that's a good question, but I don't have the answer for you. But probably within 24, I would think. Okay, someone has said CPS or drug handbook for nurses, right? The CPS is actually a difficult book to read. It's so huge, and it's got so much pharmacology information. The nursing drug handbook is better. Aside from telephone orders, are prescriptions sent via text messages acceptable? Oh, I don't even know. Eva has written, aside from a telephone order, are prescriptions or orders, I guess, sent via text message acceptable? I don't know. That's a good question. I don't know if anyone's texting orders. Good one. No clue. I'll have to ask around about that. Texting orders. Is that something that you're, who wrote that, Eva? Are you familiar with having orders text, or is it just something that you thought about? It's time to close here. Okay, Eva can get back to me. Alvin asked, what kind of drug handbook do Canadian nurses usually get? There's a variety of them. They're available at the University of Manitoba bookstore, Red River College's bookstore, Notre Dame campus will have drug manuals. You can probably go, I'm sure if you go to Amazon, you can find them. Anything that says, you know, it has Canadian content is probably better, but there's a Mosby's one, there's a Davis one, this one is a Pearson one. There's lots of varieties and they're all okay. They're all okay. We put the phone order in a physician's book for the next round to sign. Okay, Margaret, thank you for that. I'm not aware of doing that, putting a phone order in a book, but that would be a facility specific or a unit specific thing. It could happen. Do we need to know brand names for CCA? I think you need to know, usually what they'll do on a written exam or on a CCA is to give you a generic and a brand name. I think that would make the most sense to me, is to give you both, because how can you know all the names? So if you see a drug and you're not sure if it's a brand name and you're not aware of it, I'd ask for the generic name of that drug. And, or say, could I look that drug up in a book? Okay. Eva says we are in the age of texting. She asked about texting in order. I just thought of it. It was a good question, but I don't know the answer, Eva. Okay, I'm looking at the time here, and it seems like time has actually passed quickly. I don't know if there is a evaluation form to be filled out.
So I'm going to ask them to fill that out. In fact, I'm going to stop share screen. Sorry.
Yeah.
So everyone will be getting a link to, I'm just going to go right to the form. I have it here. So we want to continue to do more and more of these workshops for you, but we need to know how you found the session today. So I'm going to send you this link in the chat once I can get it. One moment. Of course, I can't paste it. Sorry, hang on one moment. I'm just trying to get the link to the Sorry, everyone. I'm just having some difficulties getting this link to share with you. It won't copy for me. So I'll ask Christina to send you a link to the survey. Please, please, please do the survey because it's really important for us. She'll send it out on Monday morning. And then the next steps. And I just want to quickly tell you about some of the upcoming webinars that we have.
Most of them are registered for them.
Oh, and I think everyone is registered for them.
January 29th.
So the next one, January 29th, how to become an RN, LPN in Manitoba. And then the one after that is February the 11th, long-term care in Manitoba. Okay, I'm just looking, Mary Shane has another question.
Okay. Okay, that's a legal, you're asking me a legal question, which the question, do we practice amicable settlement in Canada in unavoidable circumstance arises? And you know what? I'm not a legal expert and I can't even answer that question. I'm not exactly sure what even the terminology means. Probably means an out-of-court settlement. Likely yes, but this is not a real big issue for us in Canada. I have never I don't even know of any personal situations in all my years of nursing where there was a situation that I'm aware of. I might have read of something, but nothing ever. So I don't know. That's a good legal question, and I don't know the answer. Sorry.
Okay. Are there any other questions? Maybe we can unmute the mics and give Betty Jean a round of applause.
No.
No. You can let her know. I've unmuted
Thank you,
everyone.
Betty.
Thank
You're
you
welcome.
so much.
Thank you.
Thank you so much.
Thank you.
Hopefully
you.
on,
Thank you, Betty.
hopefully on the survey.
Sorry, okay.
9636198. 9636198.
And I'll just mute everyone again.
Okay,
sorry.
so thank you for participating. If you have some suggestions of content ideas, please put them in the survey if they ask that question. Or else you can also talk to your instructor or Manola or somebody if you have a suggestion for a topic. We present topics, but there might be a good idea from one of you.
I'm just going to try one more thing to try to get this.
Briar's just going to try and see if she can get that link again, right?
Yeah, just bear with me. I'm on my own computer. I'm going to get this link so that you can do the survey right away because I know how important that is before the weekend. Here it is. I got it. I'm putting it in the link. So you can just click it. And if everyone can go there right now and let us know what you thought and any other ideas would be fantastic. Can everyone click the link? Is it working for you? Yes, great. Lovely. Okay, if there's nothing else, I'm going to stop the recording now and bid adieu until next time.
Bye-bye.
Thank you, everyone.
Thank you. Goodbye.
Bye.
Bye.